Welcome to In-Depth, an in-depth look at the interesting, educational, and timely topics affecting you right here in South Central Iowa and beyond. The one to count on for today's local news coverage is KNIA and KRLS. Now with today's In-Depth, here's Dr. Bob Leonard.
Why is it important to undergo regular cancer screening? Let's go in depth with Mary Jo Van Roekel with Pella Regional and patient Steve Van Wyk. Mary Jo, can you tell us what the infusion center does at Pella Regional?
The infusion center does lots of different things. 60% of our patients are chemotherapy patients. So we give a lot of chemotherapy, and we work closely with Mission Cancer Blood in administering that chemotherapy. And then we also have antibiotics, rheumatology infusions, infusions for Crohn's, immunotherapy, all different sorts of infusions and injections.
So how many people might go through your office in a day, the lab? I presume you call it a lab, or?
We call it an infusion center.
Okay.
I would say anywhere from 15 to up to 29, 30, depending on what day we have going what.
So describe the culture of the center.
We work very closely together. We have a close-knit team. There are not many of us. And we work closely with all of the family practice doctors, Mission Cancer Blood for the oncology, and then we have many outside facilities that send us orders also, many specialists. And we work together. We try to make it accommodating to the patient to get what they need when they need it, and explain what we're doing and how it's to help them. And we just work really closely together, and we all get along. We like to laugh, and we enjoy our jobs, and we enjoy our patients.
Well, and Steve, share your experiences.
Well, 20 and 18, found out I had colon cancer, so they did a resection of my colon. So then in January of 19, I started coming to the infusion center. Did 6 months of chemo there. Then in 2000, so then they was doing tests all the time to make sure that my cancer was gone. And then in 2021, we did a test and my PSA level come in at 10.8, and we decided I had prostate cancer. So then I went to John Stoddard, and they did what they call brachytherapy, which is planting seeds in my prostate. And then I did 5 weeks of daily radiation at John Stoddard. And I'm still on a maintenance cancer pill now, and then also every 3 months I get a shot. So I get to come in and see Mary Jo and the girls. Over the last 4 years, we've probably built a pretty good relationship. They always seem to want to pick on me, and I'd never do nothing to them, you know. But the infusion center in Pella is fantastic. You know, they take care of you. My wife always come in, and they took care of her just as good as they did me, you know. And I think sometimes we forget the spouse is going with you and maybe struggling harder than you are. But yeah, they just do a fantastic job here. I was coming in every month. Now they got me coming in every 3 months, so I don't get to see them quite as often. But that isn't, I guess, all bad that I'm doing good, you know.
More in depth after this. I continued my conversation about cancer screening with Mary Jo Van Roekel with Pella Regional and patient Steve Van Wyk. This is a month where we're talking about screening.
Correct.
Tell us about that.
February is National Cancer Screening Month, and there are many very easy, painless tests that can be done to prevent many cancers. As Steve mentioned, prostate cancer is a simple blood test. Colon, rectal cancer can be a simple test you can mail in, or a colonoscopy. The cervical cancers, there's all different ways we can do simple, painless tests to prevent or catch a cancer early. The earlier you catch cancer, the better the chances of survival and staying ahead of the game, as they say. So lung cancer also has a low-dose CT scanning that can do for people with a smoking history or that are at high risk. So it's just a good time to talk to your family practice provider about those screenings, what's available to you, and what can be done to promote those screenings. So we're just trying to promote people to do those easy, painless tests to detect the cancer early.
And so what are the barriers to people getting tests?
It can be any number of things. It can be financial, it can be
Not willing to do it?
yeah, a lot of people are very unwilling because they're scared of the unknown. They don't understand what it entails. Transportation can be a barrier. We're working on that. I am currently doing an oncology navigator position, which is very similar to Kim Pearson does that for the breast cancer patients. So we're trying to navigate them through the system and encourage people to do these testings, find out what those barriers are and what we can do to overcome them so that they can get the testing done or the treatment, whatever they might need.
Steve, were you afraid of the unknown?
No. I mean, it was a game that I was dealt, so we just kind of took off and run with it. And I know I've said this already, but the girls in infusion, they're special. They are dealing with people that are sick and possibly dying, and they're always in a good mood. They work great with you. It's just till you experience it, it's hard to explain. We always had a good time. I'd come in about 8:30 in the morning and we'd do some blood work, and then I'd go see Dr. Weeby, and then we'd make sure that I was able to take chemo, because they watch your let's see, it's platelets, ain't it? The blood work, the platelets. I know one time they wouldn't let me do it. I talked them into it a few times when I was lower than they wanted me to be, but I wanted to keep doing it, and we did it. And John Stoddard, when I did radiation, same scenario, just fabulous people to work with. I don't think people that haven't had it done don't appreciate what nurses, doctors, and so do, because it's when you're working with people, when you're a nurse and a doctor, you're working with people that are sick. Sometimes you can help them, sometimes you can't. And you build a relationship with all the people that are going to there too, because you see them every day or every other week, and pretty soon you don't see them anymore. Well, you know what happened to them. So, and best part of it is when you get to ring the bell. When I got done in John Stoddard the last day, I got to ring the bell and walk out.
More in depth after this. I continued my conversation about cancer screening with Mary Jo Van Roekel, with Pella Regional, and patient Steve Van Wyk. And so, do you think because of screening, you're here today?
Yes, sir. And because of these.
You're pointing at Mary Jo.
Yes.
And her staff.
Yes. Now, I'm going to tell you a little story. So, I worked through all of my chemo and every day, and also my radiation. And one time, one of the nurses was a different nurse, and we was probably 3/4 of the way through my chemo, and the nurse says to me, she says, "They tell me that you're working every day." I said, "Yep." And she said, "You must be one tough man." And my wife says, "Have you never met a stubborn Dutchman before?" So I'm not sure if that was a compliment or an insult, but anyhow, that was my story. But yeah, get tested. It's not that big a deal. A colonoscopy is not that big a deal. I just had one again the other day, and Mary Jo, correct me if I'm wrong. I had to have some stuff done in Des Moines, and we did a colonoscopy, and I hadn't had one for a year and a half, and they found a couple polyps. They took them out, and they was negative. But what they told us, and I didn't realize this, and you might have to bleep this out, but certain polyps have a cancerous trait, and certain ones don't.
That's correct.
And the 3 they took out of me 3 weeks ago had the cancer trait. So if we wouldn't have done that, we caught it early enough that I don't have to do nothing.
So, screening. That's what we're about today, screening. So, it saved you more than once.
Yeah.
And those screening tests can all be done locally here in Pella. Pella offers all of those things. Most of them can be done through your family practice doctor. And if they don't offer it to you for whatever reason, it's okay to advocate for yourself and ask the question. They may feel you don't need it yet, or it's something to be done at a later date, but just start the conversation.
Mine, I had, just so you know, I had some other stuff that I had to have done up there that only certain doctors will do. I was passing some blood, so they had to go up there and cauterize some spots. That was from radiation damage. So
Most of those screening things can be done in Pella, and I think most people appreciate to be able to do it. I think Steve would prefer to do those things locally.
Yeah.
If you can. There are certain aspects of some of those tests after, that need to be addressed by the specialists.
Right, but most of us don't like that drive to Des Moines.
Exactly.
If we don't have to, especially for medical
Absolutely.
issues.
Yep.
Well, Steve, we were talking, and it's like we first met. I think I first interviewed you nearly 20 years ago, and you look real healthy. I mean, you just look healthy. You look like you're doing fine.
Yeah, no, I am. I mean, this is what I believe. God wasn't ready for me to go to heaven, so that's why I'm here.
Any last thoughts you'd like to share today, Mary Jo?
I just want to stress the importance that, again, these cancer screening tests are usually painless, can be done locally, and if you need help, we can certainly advocate for whatever that might be, transportation, or if it's too difficult of a conversation to have, we're here to help people get through those barriers so that they can get these screening tests done and feel the best that they can feel, and we advocate for screening. As I said earlier, the earlier we can detect these cancers, the better the outcomes as a rule.
Thanks to Mary Jo Van Roekel and Steve Van Wyk for contributing to the program. For KNIA KRLS News, this is Dr. Bob Leonard bringing you today's news and information in depth from our little corner of the universe.
An audio copy of today's in-depth program is available at kniakrls.com on demand or for download. Just click podcasts. If you have topics or show ideas you'd like to hear in depth, contact KNIA KRLS by sending an email to bobleonard@kniakrls.com. The one to count on for today's local news and the #1 news and information source in South Central Iowa is KNIA KRLS.